Hello, hello, and welcome to another podcast episode of Overpowering Emotions, where I talk all things big emotions, emotion regulation, and of course, resilience. We're on our journey of resilience. And today I'm delighted to have a special guest, Lauren Pasqua. She's going to be talking with us about family dynamics and resilience, which is something that I have talked a lot about and written about. So check out articles. I will have them in the show notes. Dr. Pasqua is founder and executive director of Connections Child and Family Centers, a group mental health practice in Northwest Houston. With over 15 years of experience, Dr. Pasqua, a licensed clinical psychologist, and her team of experienced clinicians provide counseling and evaluations for children and families across Texas. To address a public health crisis of high suicide rates in the local county, Dr. Pasqua and her team have created an adherent DBT program for teens and families, and it really focuses on supporting teens with significant behavioral and emotional discontrol. And they are on a mission to help parents build a validating environment to support their teen in healthy coping and mental resilience. And you will be hearing a lot about that validation piece today in our discussion, and something that I know I've always talked about and things that we're hearing about more and more, which is important for our children's resilience. So enjoy. Well, thank you so much for joining me on the show today. Why don't we start by having you introduce yourself to everyone who's listening?
Great. I'm Dr. Lauren Pasqua. I am a clinical psychologist and a group practice owner in Northwest Houston. My practice specializes in working with kids and families experiencing big emotions and big behaviors.
Which is right up the alley of this podcast. That's exactly what we're talking about. And specifically resilience. We're on this journey of resilience. And the one thing that I really wanted to talk with you about was just looking at family dynamics and resilience. So maybe we can start there, just how these family dynamics really play a role in building our kids' resilience.
Sure. Well, I haven't listened to all the things that you've already spoken about, and I'm sure we'll probably have a lot of overlap in our thought process. But from my perspective, kids come into the world already pretty resilient. And then over time, they begin to lose that natural resiliency. They become less present. They go from enjoying the moment to worrying, and all the what ifs start happening, worrying about their future. And that can be really overwhelming for them. I think as parents and as teachers and other settings, there are certain things that happen in the way that we respond to kids, the way that we interact with them, that might enhance that loss of resilience. I think we all really want to see our kids succeed, and we want to see them be successful by the standards which we're told, life should happen, which would be A to B to C to D. You go to school and you get good grades, and then you go to college, you get married, you have a good job and have children. And we kind of sell this idea that life should be linear. And really, that's not true.
Yeah.
I think that is part of the problem. And that I think as parents, we've kind of bought into this idea, right? That we should help our kids get good grades, that they should be happy all the time. And we should protect them from anything that could go wrong to help them have that linear life. And they start to feel this pressure, like, if I don't do all these things, I'm not going to reach my potential. I won't be loved or accepted. And so I think there's things that as parents and as caregivers, we could do differently to help kids retain more of their natural resilience and to help them build additional resilience as life goes on and those difficult moments do come up, because they will.
Yeah, absolutely. And I talk a lot about some of the traps that we fall into, always well-intentioned, whether we're parents or teachers or even psychologists, well-intentioned, and yet we are sort of crippling that resilience. So maybe before we go into the things that we can do differently and the things that we can do to support, I don't know if you have any traps that you're thinking of off the top of your head that we do sort of unwittingly.
Sure. Well, I think we have a tendency to, all of us as a society, we have a tendency to overschedule. We have a tendency to become obsessive with whatever this idea of perfection is. And we're always comparing ourselves and our kids to others and to what we think they should be doing. I think there's a lot of desire for kids not to have big feelings in particular, that we would rather they just sort of, buck up or move on. And that's just, I think, not really reality. Instead, I think it's important that we help kids become aware of who they really are and feel comfortable being who they are, being authentic, living, from a place of being genuine and connected to who they are, connected to each other, connected to us, and connected to their feelings to build that resilience.
Absolutely. And that's just it. I mean, being able to experience everything that comes through life rather than, trying to make it all. I always talk about Pollyanna, right? Like everything is perfect, see the silver lining on everything, and never actually just sit with some of that discomfort. One of the things, I know we're going to get into some of the DBT. What's a dialectical dilemma? Maybe how does that fit in here, and what is it, just to explain to our listeners?
Sure. So I always like to sort of start with an example and ask people, like, so when you think about parents and kids, what are the kinds of issues that you notice they get really like polarized, stuck, totally disagreeing on, right? Opposite sides of things. Things like curfew, grades, computer time, dating, friends, studying, all those things. Like you see kids get very, very polarized, right? And very stuck where the parent sees it one way and the kid sees it a different way. And we can't seem to move past that. And what happens when we get stuck in our own viewpoint is that it causes an increase in conflict in the family, right? And it lowers that feeling of connection and relatability. So a dialectic is the idea that both these things can be true at the same time, that there can be two sides to a story and that neither side is necessarily the right one, right? Two ideas being true at the same time. And when we can synthesize or bring these two things together, it creates a new truth, a new way of viewing the situation. There's always more than one way to think about something. So that's a dialectic or dialectical dilemma. And I think an example of that is you can be tough and gentle, depending on the situation, right? You can be trying your best and still need to try harder,
right,
and learn more. And both of those are true. Neither one is right or wrong. It varies a little bit on the situation and the circumstances. So I think helping families learn how to begin to lean into this idea and get curious about the other person's perspective, whether that be the kid or the parent, can really start to shift that stuck point that happens a lot in family dynamics and increase that feeling of being connected.
And that's really what I talk so much about, is just being able to stop and listen without, jumping ahead with our own agenda. It's our yeah buts that really get in the way. Yeah, but, you got to go to bed, or you got to do your homework, or we're just jumping in with whatever, those types of things. So how, maybe we can just take back a step then, how DBT specifically can be applied to address some of the family dynamics pieces. And then you talked about too, walking the middle path to increase resilience. So maybe we can jump then to there.
Okay, great. So I think one of the main things that I think is powerful about this idea of parenting for resilience, parenting with a DBT perspective, is helping learn how to validate kids' experiences and validate our own experiences. And validate, I think, when I say that, people are like, well, I don't agree. I don't agree with what they're doing, or I don't agree with what they're saying or thinking. And I just want to caveat that validating doesn't mean agreeing. It means acknowledging and understanding what someone else's experiences are in the moment that they're experiencing based on what the context is. So it makes sense that you would be upset that I took the iPad away when you were not finished with your game. And there's the dialectic. The rule is that you have to turn it off at, 4:00. So I think, again, here's an example of where both things can be true. But by validating and I'm trying to lean into what is that child's experience of this rule, it creates less conflict and more connection.
Yeah, it's finding that truth there. And I often do that. I do a lot of like optical illusions and auditory illusions as well. We're hearing the exact same thing, but you
Right.
are hearing a different sound from you, right? But the both of you, based on your experience and perspective, are correct.
Hmm.
But even though they're different. And so I love doing those just as an introduction, just to show how we can be in the exact same situation with the exact same experience, but there's something different, just how we're looking at it, processing it.
Right.
Really, it's top
Perspective
down.
is, yeah.
It's really what we're thinking about it, right? How we think about what information we're taking in. So, yeah, that's powerful.
Yeah. It's all a matter of perspective.
So I just want to take a step back because we've been talking about this DBT, maybe just for people who don't know DBT, because we're both psychologists. So anyone who doesn't know, what is DBT, just to help us frame it?
Sure. So DBT stands for dialectical behavior therapy. It's a treatment, a therapeutic treatment modality that came after cognitive behavioral therapy. Many people have heard of CBT, that's cognitive behavioral therapy, but not as familiar with DBT. It was developed initially in the 80s by Dr. Marsha Linehan in an effort for her motivation was to find a way to treat individuals that were highly emotional and had high suicidality, particularly people with a particular diagnosis. But since then, this method has been researched extensively with different populations, different age groups, and it has been found to be very helpful working with teens and kids and families, also who are experiencing intense emotions, high conflict, and difficulty, handling distress. So that's really what DBT as a big picture is. And as it's executed, usually it includes learning a very structured set of skills that's delivered either in a class format, like with other individuals or other families, or in individual one-on-one sessions. And then the individual or the client, if we're seeing a kid or a parent, also has therapy sessions where they're learning how to apply the skills in their daily life.
Okay. And we know, it's so helpful, especially with some of the big ticket emotions. I mean, even just looking at big diagnoses like borderline personality disorder. What about this approach makes it so effective?
Well, one of the things that makes it really effective that was really kind of a divergence from CBT. CBT is a very change-oriented treatment where the focus is on changing thoughts, changing behaviors, changing emotions. And what Dr. Linehan found was that for some people with high intensity emotions, they really had a hard time with that constant focus on change. And it actually often caused them to discontinue participating in treatment, and they really didn't make the progress that would be expected. So she figured out that we have to also add in another component on the other side, and that is helping people accept where they are, accept their emotions, accept their thoughts. And as a therapist, we're often vacillating between providing acceptance and understanding and offering strategies or suggestions to make changes. And we have to kind of go back and forth doing a little dance between the two.
I focus a lot on that acceptance piece. I often will use dials and I say, this is our, for example, anxiety dial. We actually have zero control over that, really. I mean, we can try to do different strategies, but at the end of the day, unless it's something physical or maybe, the jumping into cold water or something, but we don't really have a lot of control over that. But we have other dials, like a willingness to be with it and accept it, right? And experience it. And the acceptance style to, I often give the example of maybe you're older and you've got a younger sibling that you have to babysit and you had wanted to go hang out with your friends. It sucks that your sibling is there, just like it sucks when anxiety shows up, but you can't ditch it, right? You can't ditch your sibling. We need to be able to, okay, you're here, accept it. And then what am I going to do? And make the best of it. So yeah, That's so important because I do think that that piece has been missed so much in a lot of different approaches, and just in what I see people doing, or families have done with previous therapists. So
I'm in agreement. Yes.
yeah.
Yeah.
And so what's this middle path?
So that's like trying to find
Oh,
the
right.
middle path
Yeah,
between your idea, my perspective and your perspective. And how can we compromise? How can we find a solution that is in the middle? And
right.
maybe that won't always happen, but many times we can when we stop and slow down and consider, right? And think and validate.
And how does that build resilience if we're tying it back to the resilience piece?
Right. Well, I think it builds connection, it builds trust, and it builds trust internally for the child that their experiences are understandable and they make sense and they are acceptable, even if they're maybe not understood, or they're understood even if they're not accepted. I think that builds that feeling of resilience of like, I know who I am and I can be who I am and I can be seen for who I am and I can express myself rather than having to shut it all down and hold it all in, or explode to get my point across and bring
Right.
it up to the next level.
Yeah. I guess in those moments where it is, kids get dysregulated, they're experiencing big emotions and it is coming out maybe aggressively or just,
Sometimes.
in a way that parents don't necessarily, feel is very respectful. What could parents do in those situations?
Sure. So parents often say, they come in to see us wanting to change something. There's usually something wrong. I want you to fix my kid or fix my family or fix this problem, right? I don't like this. How can I change them? And the truth is, it has to start with accepting where you are right now, where your child is right now. And at any time you want to make a change, whether it be like you want your spouse to start taking the trash outside, on a routine basis, or you want, I don't know, your son to vacuum the house when it's his turn to do so, then we have to start with validating their experience, to drawing them in, making them feel understood, making them feel connected before we shift to doing a change strategy. I think one that I often talk about is, I think all of us can relate to this, where, maybe you've come home from a hard day and your partner or your roommate or parent, if you're living with anyone like that, you just want to, you had a hard day. You're just feeling so upset. It was just awful. And you want to tell them about it and unload. And the response that you get is not what you expect. It's, oh, that's not such a big deal. It could have been a lot worse. Oh, you should have done this. This really would have solved your problem. But that feels pretty awful. It's definitely not what we're looking for and not what we need in the moment. And it leads to these feelings of maybe I got it wrong or maybe I really screwed it up. And it definitely leads to more disconnection and a lack of trust between the individuals, as well as lack of trust in our own experiences.
Which is so true. I mean, that's something that I talk about a lot, and one of the traps that we fall into. And like softening the blow, right? Softening emotions. I think that that's one that we're trying to make our kids feel better rather than helping them learn how to manage feelings in the first
Right.
place.
Yeah, or we don't agree, or we think, perhaps they were overreacting, not taking the time to slow down and really lean in and try to get curious. I love for parents to practice being curious and learning about their child's inner world. And I think that's all we really want when we're coming home telling that story to our spouse, is just to be heard, to be seen, to be understood.
Right. Yeah, absolutely. Anything that we've missed, any other skills, essential DBT skills that parents can use to help support their kids' resilience?
I mean, I think a lot of DBT skills. So the model for adolescents and for kids really is one that is a parent-child model, where both parents and kids should be learning the skills in 5 modules. The walking the middle path ones include acceptance strategies like validation, and they also include change strategies. I emphasize those less, usually because those are the ones parents want. and they sort of overlook the others. But in terms of what are things that parents could be doing, I think that learning some of these skills that would help kids tolerate distress and help parents learn to tolerate their own distress is really essential in building resilience. Because if we can't tolerate distress or discomfort, unexpected changes, then it's going to be very hard to overcome bigger adversity when that happens, when the life veers off the A to B path, and we know it will. So things like learning how to tolerate distress, and there's a lot of specific skills DBT teaches. One of my favorite ones is really actually very easy. When we dive into cold water, this reflex gets activated, the dive reflex, and it actually immediately causes the parasympathetic nervous system to activate and slows down our heart rate, all of the expression of cortisol, etc. And it kind of starts to calm the body almost immediately. So in a situation where there's a lot of emotion and people are really ramped up, this can be a quick and easy way to bring down that reactivity. And we just actually tell parents, we use like the frozen eye masks, and you put it on your face, and you like kind of lean over like you would be diving and leave it there, counting to 5 if you can tolerate it. And it's pretty incredible, the immediate reaction you see. You can even just use frozen vegetables if you have them.
And what if they're out in the community and they just don't, like, there is nothing like that they have accessible?
Right. That's a good example. I mean, in the community, you always could go into, if you wanted to use that particular skill, if you find that one really works for me, like it really gets the reaction that I need. I mean, it would be easy enough to just go into a bathroom and splash cold water on your face. And it doesn't maybe respond quite the same to quite the same level, but it does still provide a similar response. I think it can be a good one, a really easy one. You can even just pat your face with, a cold napkin if you're like at a table at a restaurant or something like that. It's very flexible.
Right. Or in a car. I'm just trying to think, because I often talk about we need to give strategies that you could do naked in the shower, right? Like, so
that would definitely work. You'd have cold water.
Well, yeah. So just like if you're in a car, like you just couldn't have something physical that you could use to cool yourself down. Do you have any other strategies?
Sure. Do I have any other strategies? Well, paced breathing is also a part of TIP. So tip the temperature, intense exercise, paced breathing. So that one can be done really anywhere because your breath is always with you. It's a part of you. Now, some people really dislike breathing exercises and they'll be like, I've tried that, I'm not into it.
Yeah.
So I kind of try to de-emphasize that one just because I get that kind of pushback quite a bit. And I think it can be helpful to have new ideas. But pacing your breathing, counting, in and out at the same pace, potentially while focusing on something in your view. Often we just tell kids like, look at a picture on your phone, or if you have a phone, for teenagers in particular, or something like that you can really just kind of focus your mind on as you're counting the breath equally in and out, breathing in through the nose and out through the mouth. So that paced breathing can also provide a similar deactivation response.
Okay. So, and you were talking about being able to tolerate distress as well. So that sounds like it's helping just slow down, putting the pause. That's how I talk about the parasympathetic, right? We're just putting the pause on the brakes. Fight. Yeah. So then when it comes to some of the tolerating distress, are there any specific skills that you would want kids or parents both to be focusing on?
So that would be tolerating distress. From DBT perspective, tolerating distress is not solving a problem. I think people think that when we give them these coping skills to, do things like activate the parasympathetic, that they should feel all better. And that's actually not the goal. And it's definitely not going to happen. It's really, like you said, to put the brakes on and allow someone to slow down and think, okay, what could I do next? And then what could I do after that? To get through a really difficult moment, ride that wave and surf it instead of getting sucked under. That's really what distress tolerance skills are for.
Right.
To get you from the difficult moment to the point at which you can start to calm down a little bit and think, and then you can start to solve the problem that you began to have initially anyway.
Right. Yeah. And my focus is it's dropping into the body. That curiosity is a word I use all the time
Oh,
because
I
we're
love that
keeping our
too.
prefrontal cortex online so that we
Mhm.
can stay in the moment, drop into the body, notice what's happening, and then that's when we can go into the procedural what's next sort of thinking.
Yeah. Well, and it
Um,
may not be that one distress tolerance skill or coping skill might not be enough, depending on the scenario that
yeah.
we're talking about. You might have to chain a few together to really get through a more different. I mean, the dive reflex is amazing because it provides a very quick response, but it may still not get you back down, to a baseline or even close to baseline. So you might need to do a few other things like depending on where you are, going for a walk outside, getting some activity, some physical activity, engaging, in some pleasurable activity that's going to help you distract your mind, and kind of think about something else for a few minutes while you try to get through those big feelings. So we might have to chain a few together.
Right. Right. Any other skills that we've missed that you think is important to talk about?
Let's see. Well, I do like the self-soothe skill. So DBT also loves acronyms. So if I gave you a lot of acronyms, it would feel very overwhelming because they have so many. But self-soothe is one that I think people can really relate to, because it really hits on soothing with your senses. So the six senses, what you can vision. So what are you looking at that might bring you pleasure or calm? What might you be listening to? What might you smell? Touch, taste, and then also they count movement in that as well. So sometimes when we work with kids and parents, as part of the program, we ask them to create a little kit, one that they could maybe keep at home, and then one ideally that would be portable, maybe like a small box that you could put in your backpack or something like that, with different items that would hit some of those senses to bring some soothing in a moment where there was a lot of distress. Again, that's not as always as easy as like something you can do anywhere you are, but it also just kind of depends on what you have around you that you can focus on to soothe, whether that be turning on a song because music helps you relax, or taking a walk, moving your body, doing some jumping jacks even.
Right.
So
Right.
sometimes those things can be with us wherever we are.
Okay.
Yeah.
And is there anything I find the biggest challenge is just knowing when we need to use some of these skills, right? Not getting immediately triggered and
Mm.
dysregulated, but being able to take a pause to be able to say, okay, I need to actually use some of these skills before I fly off the handle. Is there anything to help with that? Just some of that self awareness or work
Um,
that needs to be done before?
right. Well, I think that's where the mindfulness skills component of DBT comes in. Um, and it's an aspect of DBT that's integrated into the whole program from start to finish. Every session gets started with a mindfulness activity, really helping people work on training their brain to be more present and aware and drop down into their body and into the present moment, like you were describing, and just really being focused on what's happening right now, not thinking about what's going to happen in the future, not what happened, an hour ago, just right now. And we find that this is something that's really difficult for many of us. And we have to really practice it, much like we would practice learning any skill, riding a bike, cooking, anything. So that's why it's so essential to practice it at every session that we do. But really, mindfulness can be done anywhere you are, and it's a doing. I feel like it's a doing rather than a being. Um, when people hear mindfulness, I often find they think, okay, so I have to like go sit on a pillow and like close my eyes and hold my hands and meditate. Like, no, 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 no. That's not mindfulness. That's not meditation. Mindfulness is a doing practice. So walking mindfully, paying attention to where your foot is and how your leg feels when it's moving and what's kind of the colors and sights around you, instead of just moving along at a fast pace like we usually do, doing so with thought and intention is a mindfulness practice.
Yeah. And it's not trying to change what's happening. It's just noticing what's happening as you're doing it. And I think that's the big one, right? Because I'm trying to be mindful, but my brain is full of thoughts and the monkey brain is jumping around. Well, that's being mindful of what's happening in the moment rather than trying to force them and change things. It's just being present, being able to take that sort of arm's length back a little bit to notice. So that's such an important skill, that
Good.
mindfulness piece. And it's so good on, I mean, so many different levels, so many different benefits. Um,
So
lot,
observing your thoughts, like you're saying, that
yeah.
monkey, right?
Yeah, yeah. So lots of things, lots of great things. Anything that we've missed?
Oh, and there's so many things to talk about. It's hard to decide on which one we should focus on.
I know, I know.
Um, well, I mean, I think the last one of the areas of DBT that I think is really cool for families is learning some interpersonal relationship skills and how to ask for things without being aggressive, how to get your needs met in a way that keeps your self-respect, how to say no in a way that feels acceptable and not giving up too much. And one of my favorite of the interpersonal skills is the give skill. And it's, of course, an acronym because they love acronyms. And it stands for gentle, interested, validate, love validation, and an easy manner. So being kind of gentle in the way that you're communicating, checking your voice tone, um, acting interested, leaning in, giving eye contact, validating what you hear, or observe, even if you're noticing facial expressions or body language. And then trying to use an easy manner, not getting kind of towering over someone or using our physical prowess and space to look in a threatening way. Just kind of leaning back, hands, open, that brings people in instead of pushing them away. So the give skill, I think, is a really, really great one.
I love that. And I love that you gave the acronym because I think that does help. Well, that's why there's always so many acronyms to help us remember. And I think that that's a really good one for parents because at the end of the day, that is critical, just how we're interacting with our kids and making sure they do feel heard and understood. And that's why validation is so important. Well, this is wonderful. Thank you so much for all of these tips. I have all of your information that I will put in the show notes, and it looks like you have a resource as well that I'll make sure I include. For people who are listening right now, how is the best way for them to find you if they want to look you up?
Yeah, so I'm on LinkedIn. My group has a Facebook page and an Instagram page and a YouTube page. So we have quite a bit of social media, and of course we have a website. So any of those places would be good.
Amazing. Thank you so much for coming on the show today.
You're welcome. Thanks for having me.